Hello, everyone. Welcome to Therapy Clips with Dr. O. I'm from Human Service Consultants. Today, our topic will focus on strategies for anxiety. So, basically, in these strategies, what you will be learning are some techniques to help you to manage your anxiety. So, just a brief overview of what anxiety is all about and some of the symptoms that's related to anxiety. Okay, so anxiety is a mental and physical reaction to perceived threats. In small doses, anxiety is helpful because it protects us from danger and focuses our attention on our problems. But when anxiety is too severe, it can become debilitating. Some of the symptoms of anxiety is uncontrollable worry, poor concentration, excessive nervousness, increased heart rate, sleep problems, upset stomach, muscle tension, avoidance of fear. There are a couple types of anxiety that I'll discuss in this presentation. One being generalized anxiety disorder. That is an excessive amount of anxiety or worry in several areas of your life. For example, job responsibilities, health, finance, or even small concerns. The next type of anxiety is phobias. This type of anxiety involves an intense fear of a specific situation or object that's really out of proportion to the actual threat. For example, it could be the fear of giving speeches or spiders or even social situations. The next type of anxiety is called panic disorder. This is when someone experiences extreme anxiety in a response to having several panic attacks. During a panic attack, the individual experiences numerous physical symptoms and is overwhelmed by a feeling of dread. How does this anxiety grow inside of some people? First of all, the person is feeling the symptoms of anxiety that I spoke about. Then they try to avoid it. And as they try to avoid it, it becomes more intense. So anxiety drives people to avoid the things that scare them. When a scary thing is avoided, there's an immediate but short-lived response of relief. However, the next time the person have a similar situation to arise, it will feel even scarier. This creates a harmful cycle of avoidance and worsening the anxiety. So once the person has the anxiety, they try to avoid this scary thing. That will give them a temporary relief. But then, the next time they encounter that particular type of anxiety, it will be worse, their feeling of dread. So now I'm going to talk to you about some anxiety treatments. The first one is called cognitive behavioral therapy. Cognitive behavioral therapy, or CBT as they call it, is a very effective treatment for anxiety. During CBT, the unhealthy thinking patterns that create anxiety are identified and challenged. Oftentimes, CBT will include components of exposure therapy and relaxation skills. So the next category of treatment that we'll talk about is exposure therapy. During exposure therapy, the therapist and their client create a plan to gradually face anxiety-producing situation, breaking the cycle of avoidance. With enough exposure, the anxiety loses its power and the symptoms diminish. The third category is relaxation skills. There are various types of techniques, such as deep breathing, progressive muscle relaxation, and mindfulness, that provide immediate relief from a symptom of anxiety. With practice, relaxation skills will become a positive and a powerful way to manage the anxiety in the moment. And the final category that we will talk about today is that there are medications available. Medication can help control uncontrollable symptoms of anxiety, but it doesn't fix the problem. So because it doesn't fix the problem, then therapy is also suggested. The need for medication varies greatly, and it is on a case-by-case basis. Some people will need it and some people may not. With this being said, I'd like to thank you for your time. This is Dr. O from Human Service Consultants, bringing you another therapy clip that I hope will be helpful in helping you to manage the symptoms of anxiety. I want you to have a blessed day, and by all means, relax. Hey, the world is here, but we don't have to participate in everything that's going on in it. Take time for yourself. Deep breathe, meditate, and just relax. You're worth it. Until I speak to you again, be blessed.